Hello, I'm Dr. Kurt Midget. I'm an endocrinologist at the Midwest Pediatric Specialist, uh, and I've been asked to talk a little bit today about type 1 diabetes in kids and COVID. We all know COVID well at this time, and it's certainly been a very stressful issue for all of us as we've had to deal with this pandemic. But one of the reassuring things that I think we have seen is that kids with type 1 diabetes are not at a greater risk for developing COVID or getting COVID during this time. There's a lot of information that families may have seen in the media and in press about risk factors for complications from the COVID illness, and diabetes gets included in that conversation many times. But I think it's important to realize that the patients that are developing the complications tend to be older patients with a history of poor control of their diabetes. On top of that, over time, they have also developed other medical illnesses and associated problems, such as heart disease or lung disease or kidney disease, and also obesity that puts them at a greater risk for some of the complications from COVID. That's not something that we're seeing in kids and young adults with diabetes that have generally good control. And I think it's a very reassuring factor. And the guidelines that are existing for wearing masks and social distancing and good hand washing are the same guidelines that we would be discussing with families of kids with type 1 diabetes, because that's the most important thing that we can do to decrease the spread of this illness. But if a child does get COVID and they have type 1 diabetes, the management is not going to be any different for their diabetes than we would for any other general illness that a child might get. Sometimes we can see a child that has a higher blood sugar when they're ill and they have a cold or a fever. And in that setting, we have to make adjustments to the amount of insulin that they're getting. If they're using a pump, sometimes we will use something called a temporary basal rate, or they're on injections. Sometimes we have to modify some of the long-acting insulins that they're taking or give some corrections. But those recommendations for sick day management would be no different if a child had COVID. And in fact, most of the children who might develop an illness with COVID often are asymptomatic, and we might not be even aware that they're having a problem. So it's very reassuring that the patients that I'm seeing in my clinic for the management of their type 1 diabetes are not having greater issues because of this pandemic, and we are able to manage their diabetes in the same way we always have. But I think it's always very important as we work together as a team, both the providers and the families and the kids, that we communicate with each other. And if your child does get sick or does have some concerns about the possibility of COVID, that you communicate with your endocrinologist and the diabetes team that they work with so that we can keep an eye on things. But they're not at a greater risk because of their diabetes. I hope this is helpful for you.